Hello and welcome to Policy and Advocacy in Action, a channel of NRCDV Radio. My name is Marium Durrani, and today I will be speaking to Kendra Gritsch from the Washington State Coalition Against Domestic Violence about how to meet the needs of all survivors and some innovative work happening in Washington State. Thank you, Kendra, for joining me today. Let's get right to the questions. Kendra, can you tell me a little bit about yourself and what your role is?
Sure. So my name is Kendra Gritsch, and I am with the Washington State Coalition Against Domestic Violence. And I work on our housing project here, specifically on the Domestic Violence Housing First initiative and supporting our domestic violence programs in Washington State who are implementing this approach.
Can you tell us a little bit about what's happening in Washington State? And I know you mentioned your Housing First initiative. Could you explain to the listeners a little bit about what that initiative is?
Sure. So Housing First is based on the philosophy that housing is a right and that folks are more successful in becoming stable long-term if they have housing first and then services and support. So it's really difficult for folks to get a job, go to school, or seek other important supports if they're spending their time and energy trying to find a safe place to sleep at night or a place to call home. We know that domestic violence is a leading cause of homelessness for women and children, and often survivors are in a really tough situation where they're choosing between a violent home or no home at all. We really wanted to take a look at this in Washington State and eliminate domestic violence as a reason to stay in an abusive relationship. And so we decided to see how this Housing First approach could work for survivors. It does look a little different from the traditional Housing First approach because survivors who are homeless or unstably housed, they need homes, but they also are seeking safety. And in the Domestic Violence Housing First model, advocates are providing three things: survivor-driven, trauma-informed mobile advocacy, flexible financial assistance, and engaging in their community, both in terms of developing relationships with landlords, local businesses, but also working with survivors to connect or reconnect to their community of support. The DV Housing First model was originally piloted in Washington State, and that was 9 years ago. And since then, a lot of our programs are taking this on as an approach that really supports survivors. And also just want to acknowledge that there are other states who are doing this work, including California, Colorado, and it's just sort of like taking steam across the nation at this point.
Wow, that sounds like such an interesting initiative, and there's so many interesting things happening in different states. So I know we're here today to talk about, the variety of different needs that survivors have when they're seeking services. So I know you mentioned a little bit when you were talking about the Housing First initiative, but can you talk about ways that programs in Washington are meeting the variety of needs that survivors have?
Mm-hmm. Yeah. So the Domestic Violence Housing First approach really focuses not just on letting survivors lead their process towards being stable, but it also works to expand the options that are available to survivors who are seeking safer and more stable housing. There's really no one-size-fits-all approach. Survivors' lives are complex, and what might be really helpful to one survivor might not be helpful to others. So the more options we have available, the more we can meet the needs of folks. We also know that safety and healing look different. So someone might need their locks changed in order to feel safe to stay in their own home. Someone else might need legal assistance to deal with a custody case. Someone might need their car repaired so they can get to work. Perhaps their abuser slashed their car so they couldn't get to work. When you can't get to work, it's hard to make money to be stable. Someone else might want to relocate, but they want to make sure it's in the same school district so they can stay connected to their school support network. So, that's just a lot of examples, and there are many, many more. What the approach really means is that advocates can work with survivors on what they need and what they identify as what they need, versus giving a survivor a menu of services and just hoping that an item on that menu is something that they need. What we have seen from programs, what programs are seeing is that the more options that are available to meet people's needs, the more their needs can be met. And because the approach pairs the flexible financial assistance with like with flexibility and advocacy, advocates are now really able to successfully support folks that they may have not been able to do before, whether it's due to a structure, like a program structure or facility. So people have seen that they can serve trans folks, immigrants, larger families. There's a really great story that came out of one of our DV Housing First programs that was able to help a Native American survivor and her children and the grandma stay safely in their own home. The grandma was providing childcare so the survivor could work. So we just thought, like, well, what would happen if they would have had to move into a shelter, for example? That would have meant that the survivor wouldn't have had the child care she needed to go to work, and that grandma may have been put into a position of being unstable, and that would have just, caused even more uprooting of the family and potentially more trauma for the children who are already, dealing with the aftermath of a violent situation.
Wow, what a great story. We know that childcare can be so important for survivors, and it can mean, it's the difference between going to work and not going to work and managing all those responsibilities. Yeah, super interesting. Thanks for sharing. So I know, Kendra, you talked a little bit earlier about the menu of options, and I think when we talked about survivor safety a while ago, it's kind of evolved. So the menu of options seems much broader than just kind of that traditional idea of emergency shelter. Can you talk about, is that still the main focus? Has it really evolved from there?
Yeah, so I think that what we know is that the world has changed dramatically since the domestic violence movement has begun. And so when we started looking at that, we started thinking about, like, do the services that we constructed decades ago respond to the needs that survivors, currently have? Emergency shelter and emergency housing solutions is really important for a lot of survivors and their children, and they're critical and life-saving. But again, it's not for everyone. I think what we have heard survivors say is that communal shelter can be really challenging. Sharing space with others who are going through trauma can be really hard. And then there's always the question, relating back to the, story I told of, like, what do people do if they need to live with their mother, or if they have pets, or they have big families that they want to stay in the same school? And then also just, totally removing someone from their location also often results in losing all their networks, and it's not necessarily a long-term solution. So when I talk about options and what the Housing First approach has meant, it's asking survivors, making sure you're asking them, like, what is your housing situation like? And making sure that they know that shelter isn't the only option. And when that question starts being asked, it's amazing what survivors say. So some survivors say, actually, I don't need shelter. I need rental assistance. I need my locks changed. I need help getting a job. I need help getting into a new place. So that's, asking that question is actually resulting in different answers. And as we're moving into this approach, it means that we're actually able to address those different needs that survivors are saying that they have.
That's fantastic. I think it's so important that you highlighted that, everyone has really different needs, and people know what they need best oftentimes. Something that I want to pull out that you said, you talked about the complexities of sharing, a communal space with folks who are experiencing or have experienced trauma. I think we often hear, like, trauma-informed services as often a buzzword and kind of a phrase, and people say that they're engaging in trauma-informed services. So how do you feel like programs can actually engage in trauma-informed services, and how do you define that term for you?
Yeah, so from a program perspective, having more options available is trauma-informed. It means that people can get the support around the things that matter most to them. In advocacy practice, it looks like understanding what trauma is, how it can show up in those day-to-day advocacy interactions, and then being flexible in your response around that. So an example I think we can all relate to in advocacy is the situation where you're working with a survivor that doesn't show up to an appointment on time, or they don't show up at all. And a trauma-informed approach to that would be to not make assumptions or develop opinions about why that survivor didn't show up, but to come from a place of understanding, curiosity, and openness, and having the conversation with the survivor about what would make it easier for them the next time, because maybe it's meeting them out in the community so they don't have to get on a bus and risk running into an abuser, or being in other situations that are triggering for them.
Great, yeah. I think that's such a valuable approach to take, when interacting with anyone. So I know that you talked about the housing first model, housing in general, the services that go along with that, and the menu of options. Things seem to be going really well, but can you talk about, what sorts of challenges you're seeing overall or in your state or with certain programs?
Yeah, so I think some of the challenges that we can all relate to is just the general lack of affordable housing and lack of housing available. And this is something that is happening in Washington. It's happening across the country. Also low or stagnant wages. So the cost of housing and wages are just not keeping up with each other. We also know that there's just more need than there are resources available. And I just want to highlight that a little bit because when we're talking about this DV Housing First approach and we're really deeply engaging with people around what they need and it's open and flexible, sometimes that means that the time spent with survivors is much longer because it's not just housing, it's housing and then the support to help people become stable long term. And so we're in this interesting situation where there is just so much more need than there are resources available, and advocates are trying to negotiate that all the time. And that looks different from program to program. Some programs are deciding that they want to work with as many people as possible, and then knowing that that's just going to not provide like that in-depth long-term support. And then there are some programs who are deciding to work with a few people, but a lot longer and a lot deeper. And that's a challenge and attention that is very front and center. And then, what we know about survivors is that a lot of times when they're coming out of a situation, they have experienced economic abuse. They might have no rental history or a really bad rental history due to the violence. We also see that, some survivors don't have job skills. They don't have a job history. They might have a criminal background. And so that's why the advocacy is so important, is negotiating those things with landlords. A lot of times landlords discriminate against survivors, discriminate based off of race. And so having sort of advocates there to help negotiate those situations can address some of those challenges.
Great. That's really helpful. We know advocates, do their best, and we've seen a lot of advocates get really creative with the ways that they help survivors. So I'm glad you shared all of that. So is there any advice that you'd give to those listening to the podcast, if they're facing challenges, meeting the needs in their community or challenges in their housing market, challenges in supportive services? What are some of the best practices? What do you want people to know?
Well, when I think about advocacy, I think about both supporting survivors on the individual level, but also the importance of advocates doing that more like systems level advocacy. So when I talked about some of the systems challenges around affordable housing, wages, I think that advocates have a really important role to play in communicating to policymakers, whether it's local, state, federal, about the challenges that survivors are facing and using those real life stories. So that's, one thing that I think advocates could really do to address those larger systems challenges. And in terms of like the takeaway for folks, and I said this earlier, is just that we all, make assumptions about what survivors need, whether it be housing or safety. But the more flexibility and options that we can show up with when we're working with survivors, the closer we can get to communities where people can be healthy and safe. And the advocacy is a really important piece to that work, and that everyone is deserving of services and support. And that's the work that we're doing. We also have a lot of tools and information on the WSCADV webpage, WSCADV.org, around DV Housing First, tips and tools on how to do it, what programs are doing, examples of it, and then also a lot of data and evidence to back up how this approach can be successful when working with survivors.
Great. Thank you so much, Kendra. I know you talked about the importance of advocacy, so my last question for you is, are there any other stories that you want to share with the listeners, anything that's made an impact on you?
There are so many stories. It's a matter of figuring out which.
I know. Survivors,
there's
so many stories of resiliency and creativity and inspiration. It's hard to pick just one, but.
Yeah. Well, I'll one of the questions that we get a lot is around safety, and I think that there's it's a reworking of the skills when you're talking with survivors about safety outside of the traditional emergency shelter structure. And advocates, are afraid, and rightly so, of like what are the safety concerns of survivors if they're out in the community. And so there's a story that came out of the Olympic Peninsula, which is very western Washington, where there was a survivor who was working with a program and got into a home of her own with a private landlord, and had just this history of always having to move because no matter what she did, her abuser found her and her children. And lo and behold, like one day she got a note on her door, and it was, this person saying, like, I know where he lived. And she decided, I'm going to figure out how to be safe here. And she was able to communicate with the local police department because that was a thing that felt safe for her. They were close by. The advocacy program was close by. Her neighbors knew what was going on. So she created this community of support that allowed her and her children to not have to uproot themselves again and move, but she could feel safe and knew she had people to rely on. And I think ultimately what we want to see from our communities is our communities are healthy and supporting each other, so that when the advocacy goes away, that people can still be successful and safe in their lives.
That is truly an inspirational and phenomenal story, Kendra. Thank you so much for sharing that. So thank you to everyone for listening to our broadcast today, and to my guest, Kendra Gritsch. She did mention the Washington State Coalition website, which is WSCADV.org, if you want to learn more about their work. And to hear more NRCDV podcasts and access additional resources, feel free to visit us at NRCDV.org. You can also follow us on Facebook, Instagram, and Twitter at NRCDV. Policy and Advocacy in Action is an NRCDV radio podcast product brought to you by the National Resource Center on Domestic Violence. Support is provided by the Administration on Children, Youth, and Families, Family and Youth Services Bureau, U.S. Department of Health and Human Services. Its contents are solely the responsibility of the authors and do not necessarily represent the official views of the U.S. Department of Health and Human Services. Thanks again. Bye.